because problems in your nose and your ears can have wide-ranging effects on your quality of life, such as quality of sleep, productivity, mood. All these things are, of course, important in our daily lives, and if we can't breathe through our nose, we can't sleep, we tend to be, our quality of life and our interaction with people tends to be worse. So it is something that we are very aware of, is very much better if required in this way. Blocked noses really can be due to a combination of symptoms, but predominantly are due to a structural problem with the nose or a problem with the lining of the nose. Those are the things that we try and accurately identify as to the problems, why you have that issue in the first place, to allow us to instigate bespoke treatment for that. That may involve medical treatments, and often does, but may involve surgical treatments if the medical treatment doesn't work. And that's something we can offer you as part of our service here at Benenden. The treatment for blocked ear really depends on making an accurate diagnosis. So whatever symptoms you may have with your ear, what we need to do is to listen to your history first and examine your ears very carefully to make an accurate diagnosis of what's going on. The ear in general is divided into three sections: the outer ear, the middle ear, and the inner ear. And the first thing to do with your symptoms is to accurately ascertain which bit of your ear is actually at fault. And then, depending on which part of your ear is a problem, we can instigate appropriate treatment at that stage. Throat problems are often associated with other problems with the nose and the ear as well. But again, this depends. The accurate diagnosis is the thing that we really pride ourselves on here at Benenden. We have full facilities for tonsil surgery, but also for investigation of voice problems with specialized endoscopy equipment to visualize and to assess the function of your voice box and your throat. So the key again is accurate diagnosis before treatment can be instigated. The key with all treatments first is to make an accurate diagnosis, and this is the thing really that underpins the ethos at Benenden, is to make the accurate diagnosis first. We have state-of-the-art equipment here at Benenden to investigate both the ear, the nose, and the throat. And that allows us to make an accurate diagnosis and then to instigate appropriate treatment at that stage. The initial choice of consultation is, of course, yours. So I would encourage people to come to Benenden if they have persistent symptoms related to the ear and the nose in particular, to allow an accurate diagnosis to be made. The vast majority of patients, once a diagnosis is made, do not actually need surgery in ENT. It's been widely realised that about 1 in 12 patients that come to us actually need surgery, so 11 in 12 will be treated quite satisfactorily medically. So the key is to get here early before the symptoms worsen to a point where they may need surgery. If the problem that you have can be treated medically, then often 1 or 2 outpatient visits is all you'll need. But most of the surgical treatments that we offer, if that should not work, are day case treatments. So you will come in, have your operation as a day case, go home the same day, and very quickly return to your normal activities, normal life, and in particular, of course, to work.